Well, good morning, Wesleyan community. I would like to open up our first quarter Wesleyan Assisted Living Town Hall meeting. But to do so right, I'd like to invite the Reverend Dr. Dan Bonner to open us in prayer, please.
Thank you, President Mark. Let's bow our heads together. Lord, on this day in which the sun breaks through the clouds, we are so grateful for the Wesleyan at Australia, the community that embraces us. We're particularly thankful today for those at the assisted living community, residents, teammates, and the families that support us. Thank you, dear God, that as life meets transitions, the Wesleyan is privileged to be there as your witness. That is our mission, and so we give this day's discussion and all that happens to you. In Jesus' name we pray. Amen.
Amen. Dan, thank you very much. The virtual town hall meeting that we're using today is the same format since the onset of COVID-19, the pandemic, nearly a year ago, March 2020. And as was the case with our last meeting, we have some of your resident representatives with us live, in wave that are over there. And at the end, what we will do is I have comments, but we will open the floor for any questions they may have, and myself or the team will be happy to answer those questions. Let me first start off by saying how thankful I am for this community. The residents, teammates, family members, volunteers, vendors, many others that have been really that foundation of support for the Wesleyan family throughout this pandemic and straight into the worst winter that many of us have ever seen. The incredible selflessness of this community in looking out for one another is that prime example of what we believe makes the Wesleyan so unique. Teammates were checking in on residents, family members and residents were checking in on teammates. And one resident council member stated, they aren't just our neighbors, they aren't just our employees, they are family. It's very true. We know the depth of connectivity across this community, but I will tell you, it's great to hear that that is also recognized outside of this community specifically. This past week, the Wesleyan was recognized as the Georgetown Chamber of Commerce's 2020 Large Business of the Year. This is the first time the Wesleyan has been recognized by the Chamber in this category. It was incredible to hear how Georgetown has valued this ministry since its beginnings nearly 60 years ago. We do have the recording of the presentation and acceptance. We'll be sharing that, I believe, through Touchtown and on our website, and we've sent it out. So if you wanted to see it, we were very pleased, very honored to have had that award presented to us by Dr. Fred Brent from the GISD, the 2019 award winner. While I think everybody is probably pretty tired of talking about it, we need to spend a little time talking about COVID-19. We've already received a number of questions specific to how the Wesleyan will be looking at and possibly changing policies and procedures as we progress through the pandemic. And it is in fact still a pandemic. But let me share some information about where we are today. The Wesleyan is in contact with local, county, state, and federal health and regulatory agencies daily for updated guidance and best practices with regards to COVID-19. It may or may not surprise you that the guidance being communicated to us or being pushed out sometimes into social media is not always consistent with each other. And at times it can be out of date, and sometimes it even contradicts each other. Thankfully, our subject matter experts, many of the people that you see on the screen today, have been able to navigate this information and glean from it what is mandated, what is guidance, and what are best practices. And then we use all of that experience to help us apply policies and procedures to our campus. With that being said, I've heard from many asking about how we're going to specifically respond to guidance that was shared by our governor. So let me start off by saying this. First and foremost, the policies and procedures of this campus are focused on the safety and protection of our resident and teammate population, along with our visitors and volunteers that come to the campus. Some have said that our policies are too much, that they're too restrictive. There have been some that have said our policies and procedures are not restrictive enough. I would say most of our community falls in between these comments, but I believe everybody understands their role in safeguarding themselves as well as their neighbors. Our ability to be successful in keeping COVID-19 at bay is the continued teamwork that we have been able to develop with all of you. We are also, as you know, regulated by state and federal agencies that mandate how we will handle visitation and other aspects impacted by COVID-19. There have been recent release of information from CDC, from the CMS, all the different letters that represent organizations and associations that we relate to. Even they are still working to coordinate their answers and outcomes, and we're going to be navigating those for all of you and for this community. We are very excited to see improvement in our community's health with the hope that we can begin moving towards a more normal operation. But I have to share this one very significant caveat. While those horrible numbers of new and existing cases, as well as deaths due to COVID-19 that we've experienced over the last 4 months, and really since the very beginning of the pandemic a year ago, those numbers have declined. The numbers we're experiencing today are not good. It is great to celebrate decreasing percentages, but for those who've been impacted by COVID-19, even one person affected is too many. Now, on the Department of State Health Services call on Tuesday, the state reported that in the last week alone, there were 30,000 new cases and 1,800 new deaths attributed to COVID-19 in just 7 days. What that means is that we're going to have to continually revisit our policies and procedures to be proactive in protecting our residents, teammates, family members, and this whole campus. Now, when I mean we, what do I mean? Well, certainly I mean the Wesleyan community, but I also mean our larger community, Williamson County and Georgetown. At the beginning of this week, Williamson County is still in phase red, and phase red is defined as uncontrolled community spread. Again, the numbers are getting better, but only compared to the extremely high numbers that we had been experiencing. The numbers and percentages that are being reported for Williamson County are only those that are defined as the eligible Williamson County population. That's defined as anybody 16 years of age and older. So the state is estimating that that number is right around 458,000 people. As of 11 p.m. last night, 7.9%, less than 8% of that eligible population have been fully vaccinated. So in actual numbers, that means only just a little over 36,000 people of that 458,000 have been fully vaccinated. And just over 18% of that population has even received its first vaccination. It is a wonderful step, and we have a very long way to go. We are still testing teammates weekly, and we do have concerns that are presented to us, as there are concerns, as there was with Thanksgiving, with Christmas, with New Year's, that as we go into spring break, there is an expected projection of surge in cases for Texas as well as throughout the nation. Now, the CDC has released updated guidance that begins to outline how those that are vaccinated can start modifying their restrictions in their own households. And we do consider our building, our facility, not only a house, but a home. However, guidance from these health agencies still promote that in the public settings, and we do have public common settings in our buildings, that mask use, hand washing, physical distancing is highly encouraged and required in places where it's still mandated by state and federal guidelines, which of course our building does have state and federal guideline mandates. Now, I will share with you, as there have been a lot of questions, I have been asked if I am pro-mask or pro-vaccination, if I support more restrictions or less. And the answer I give to that is, in my role as a steward of this ministry, I am pro-resident, pro-patient, pro-teammate, and that I am for the highest quality of life for this community in every healthy and safe way we can. What I'm asking of you today is to continue to work with us to take these next steps together. If you have specific questions about our current visitation policies, how they might change, reasons why they might change, I would ask you, as you do for many things, please go to your administrator, to Donna, to Dawn, to other staff so that we can help provide you with that guidance. Policy and procedure is literally changing every single day. And we're thankful that the team is being able to make those adjustments to policy and procedure, but I do understand how it can be confusing. So we want to be able to be there and answer those questions for you. Now, in addition to COVID-19, we experienced a winter phenomenon like any other in the history of, well, recent history of Georgetown, certainly. I was sharing that social media has called it many things. They called it Snowvid. They called it Snowmageddon. There were a lot of memes about winter is coming or winter has already come. But regardless of what it's been called or how it's been presented, what we do know is this: it was harsh, it was unforgiving, and its impact was felt across our nation, our state, and absolutely in this community. And again, I want to praise all of you who jumped in to provide the opportunity to help your neighbors, watching out for them, making sure that they were okay. Our teammates once again showed us their heroic commitment to this community. Many worked 24 hours straight, slept over in the buildings to make sure they were here to provide care and services, or traveled treacherous conditions because they knew that they were needed. I don't know if you have, but we heard stories about neighboring communities and how centers were abandoned by staff. The residents were left to take care of themselves, that they didn't have access to food or communication with the outside. And I am reminded that this is not just a place for our teammates to work, it is also their home with a family for whom they care deeply. The leadership of Wesleyan was very proactive in providing emergency pay on top of routine wages for all of the staff that were on site for all of the full shifts they worked, in addition to providing meals and sleeping and bathing accommodations, as many were still without power and other utilities. We are going to be doing an after-action review of the emergency over the next few months. There were many, many things that went well, but there were also ways for us to improve upon our emergency preparedness. As we look back and we find the opportunities to further develop those plans, and God forbid that we need to use them again, but it's important to be prepared, we would like your input on what went well, as well as those areas that could improve. This is being done at each building, and it will impact how we manage emergencies campus-wide. Another area that I think has been of interest to all of you has been the strategic plan for the organization. I will confess that it's a little odd at times to be thinking years into the future, as we are so focused on the management during this unusual times, specifically in the last few months, but over the last year. But I believe looking forward is important to all of us and healthy for a growing organization and ministry like the Wesleyan. As I shared before in our other meetings, all of the pre-construction work for which we engaged our development firm and architects have been completed. Now, normally the next step would be to proceed into the financing stage of this construction. However, the costs associated with COVID-19 have really caused us to take a step back. And that was the lack of available contractors to provide work due to COVID-19, the rapidly increasing costs of materials and supplies, not only because of reduced availability for use, but because manufacturing reduced because of the lack of people that were at work. In this step back, it didn't cancel what we were doing, but it did postpone moving forward until it made more sense operationally and financially for the Wesleyan. One example of this, which I think we can all relate to, is the increase in the cost of lumber. It used to be that you could get a 2x4 for a little less than $2 a piece. Today, even through one of the largest group purchasing organizations with steep discounts, purchasing on behalf of organizations across the country billions of dollars, that cost is nearly $7 a piece. You can imagine what a 350% increase in materials, not even including the increased cost of labor, could mean to a project of the size that we were planning. Our board and leadership team are still supportive of all the elements of this growth plan and are communicating with our development and financial consultants on the most productive window to get this project moving forward. There are many elements that remain a part of this project. For assisted living, that includes the expansion of the building to include more units, specifically in memory care, adding more common space, expanding common space, and of course, the thing that we all want more than anything else, additional parking. We're very excited about that. It's also going to require some reconfiguration of streets and sidewalks, and of course, preparing for the imminent placement of the traffic light at Estrella Crossing and Williams Drive. A note to that, I've actually forgotten to mention that in some of our other town hall meetings. I was at a recent meeting with David Morgan, our city manager, as well as the traffic impact study Tuesday night. That project is slated to begin in this year, 2021, and currently it has a tentative completion date of first quarter 2022. So as we get more information, we'll be sharing that with you. We find that not only to be a convenience, but a safety element for coming in and visiting, as well as entering and exiting our community. Like many organizations, well, really everybody in Texas, the storm that came through decimated healthy and struggling, as well as struggling vegetation. The Wesleyan was not spared this. We believe in and support the beauty of our campus. We want to quickly get back on track to the beautification of our campus, but there are a number of important steps that we need to consider. Our irrigation system and how that plumbing system was impacted by the storm, and then also finding the right window for doing new plantings to help with the beautification of our campus. We are seeking proposal for that. We have assessment teams coming out to assess the damage and the loss of the beautiful plants that we have, and we will be beginning that process soon. As soon as the irrigation system we know is fully functional, and then we are in the right window. I was shared with the other day, we have a teammate who, he and generations of his family have been farmers. And I'm probably going to get this wrong, but it was something along the lines of, if it thunders in February, we're supposed to get like another freeze in either March or April. I have looked ahead. There actually is decreasing temperatures coming up in the next several weeks. Probably not as much as it has in the earlier part of this year, but we want to make sure that we bring in those beautiful plants at the right time. We have talked about a number of heavy topics, but before I wrap up my comments, I wanted to share, or rather address, another question or statement that was brought to my attention from one of our residents. It doesn't really matter where on the campus, but I think it really applies to everybody. And the resident wrote this: our teammates, nursing department, maintenance department, dining, environmental services, management department, all these teammates have such high standards for serving us, the residents. And that was their statement. They said, we appreciate all their attention to our needs and wants, especially at this difficult time. The question was this: are they paid on a just scale for the expectations placed upon them? So I wanted to share this with you. The Wesleyan remains competitive, not only in our salaries, but also in the benefits that are provided to our teammates. We offer health insurance, where many organizations these days can't afford to or have not made it available to their employees. When we have seen increased benefits, we have sought after and increased the benefits of those plans, and often have been able to reduce the premiums. When we have had an increase in premiums, the Wesleyan as an organization took on that burden of the increased cost and did not pass it along to our teammates. We have an incredibly generous 401k retirement plan, especially compared to our industry. We subsidize training and continuing education. We have continued to provide annual increases. Now that may not sound unusual, that may sound routine, but I will share with you, especially in light of the storm and COVID-19, many communities like ours have not seen standard increases over the last year, and some for even years before that. We provided free meals over the last year, and even prior to that, we offered low-cost meals and steep discounts for other meal programs that more than compete with local fast food. We have actively pursued the support and funding for tuition reimbursement for teammates who are seeking further education. And in addition to the emergency pay that I had mentioned before that was provided during the winter storm, teammates that were working in a COVID-19 exposed area received additional compensation. Lastly, the Wesleyan monitors and evaluates compensation levels across our community and industry routinely. To that end, actually, our HR team and operations recently approved and implemented a company-wide adjustment just this last month for our dining and housekeeping services departments for both starting and levels of experience. Now, I am continuing to work with our team on new ways that we can make the wages we provide stretch further. We will continue to negotiate for better benefits. We are, in fact, doing a feasibility study for potential workforce housing, as well as how we can bring additional services such as daycare, medical services, and meal purchasing available to this campus for our residents and teammates on a larger scale. In closing, I want to thank you for your participation with the vaccine clinic. I want to thank our team for their hard work through the process of getting vaccines for our residents, for our essential caregivers, and really starting out into the community. So many have been thankful to have received their vaccinations through the Wesleyan. One family member told us that it has enabled them to visit without concern for the first time in nearly a year. We know that you, our residents, teammates, family members, have been very patient through all of these challenges, and we thank you very much. I know this is a lot of information, so I want to thank you for your time and attention, and we are happy to open it up at this time for myself or any one of our team members to answer any questions you might have.
Some questions. I'm Andy Carver, and this is Pat Gordon from Assisted Living and Memory Care. And basically our questions concern the masking guidance that we've received from CDC. I'm going to read a question. According to CDC, once you have been fully vaccinated, you can gather indoors in small vaccinated groups without wearing a mask. So it would seem that residents should have the option to be able to dine together with more than one person per table. If there are still residents who have not been vaccinated or have only received one dose, then there could be a designated area for them to be seated. Can we change the current requirement for all of us to wear masks? And when we go to the dining room, of course, we can take them off, but we can only have one person per table. It doesn't seem right. Second question.
If it's okay, is it okay if I respond to that, or is the second question related to it?
I can't hear you. What was it?
He didn't hear you.
No, I heard him. What I was saying is the second question related to the first, or would you like me to answer?
Yes,
Oh,
it is.
very good. I'm so sorry. Go
I'd
ahead.
like to do them all. Can we change the essential caregiver policy so more than one essential caregiver can visit at the same time if they're both fully vaccinated?
Yes.
Right now, only one essential caregiver can visit. And there are things that I need to discuss with both of them at the same time concerning money, welfare of my disabled daughter and things like that they're very much involved in, both of them. But now only one can come. The last thing is really kind of personal. As one ages, their hearing sometimes gets bad. I have hearing aids, and I still have trouble hearing. I was around guns and missiles all my career. And now then, I depend on not only my hearing aids, but lip reading. And when a person has a mask on, I'm almost cut off. I avoid social contact with people due to the fact that I have to say, would you repeat that? I didn't understand, and so forth. If we here have been vaccinated and in a small group, why can't we take our mask off to visit socially? Those are my three questions.
Well, thank you very much. First of all, thank you for your service. And we know that we appreciate that. Certainly what we're able to do today is because of that work and that of many others. In masks in general, we know that masks have been an impediment to many for the reasons that you've shared, their lack of comfort, their difficulty, for many different things. But let me start with the top of your questions with regards to the CDC. We are glad to be receiving new guidance from a number of different agencies. And what you shared with us is absolutely correct, but it also sits in a certain context. And I think one of the issues that, first of all, this team, the one you see in front of us and others, are working on policies and procedures to start looking at how we can slowly get back to a pre-COVID kind of a preventative kind of environment. We want that for everybody. We do. As I shared with you before, we are a highly regulated industry, highly regulated group, especially in skilled nursing and assisted living. So we can, as a community, receive guidance from the CDC, from CMS, which is the Centers for Medicare and Medicaid Services, Health and Human Services Commission, the Texas Department of State Health Services, Texas Department of Health, Williamson County and Cities Health District. We have to find a way to incorporate and navigate all of that guidance. So yes, we have received that information. We saw that when it came out. We saw the updated guidance that came out from CMS yesterday, I think at 4:08 p.m. And have already started looking at that. We know that Health and Human Services Commission has yet to respond, although they anticipate that they will be responding and possibly changing their mandated policies of us. They didn't say when, but I'm sure they're going to be under a lot of pressure now that CDC is released and others are reporting information. I think what I would ask at this time, hopefully doesn't feel like we're devaluing what you're asking for, but I think we need a little bit of time to incorporate the guidance that we're receiving along with what we are mandated to do to maintain our licensure. So right now, those that regulate our license have not allowed us to drop masks, create larger groups, change essential caregivers. Now we are starting to see guidance. We've already been given updates. Kelly, Donna, Bethany, Georgianne, myself, others, we're talking with senators' offices, congressmen's offices, our state trade associations, professional associations, and they're telling us what we're going to likely expect, but they have not, they've got to give it to us in statute and regulatory guidelines, or otherwise we could compromise the license of the building. But also we want to make sure that we do it with good discernment, good infection control practices for the safety of our residents, the safety of our teammates, and the safety of those essential caregivers and family members who would like to come in. We also have to be careful that when we open up environments, there could be very legitimate reasons why a person cannot get the vaccine. Clinical reasons, religious reasons, there could be any number of reasons. Whether any individual person agrees with it or not, there could be reasons. And we want to be sensitive to when we take action with policy and procedure, that something we do does not discriminate against those, or they have to explain why they couldn't get a vaccine or why they're having to wait to get a vaccine or whatever the case might be. As I shared with you earlier, we're not even at 8% fully vaccinated in Williamson County, which is way below many other counties. I believe it's below the national fully vaccination rate. And that's really disappointing when you consider the age demographic for Williamson County. So while I'm, again, very much in favor of this change in policy, blanket policy to the nation is released, but understand that some states, regions of the nation, counties, cities, communities have different levels of full vaccination. And so navigating that, finding out where we specifically are in regards to that guidance is going to be important. So everything that you asked for, opening groups, that's on our list and we're talking about it. Taking off the mask or reducing the mask. Right now, we are strongly encouraging, we know that we have a guidance for using masks that has not been lifted yet. We anticipate some flexibility coming soon. We need to see that in regulatory guidance. I will tell you that all teammates and visitors teammates will be mandated to use masks for some time to come. So all the things that you've asked for are being worked on, even though that they have not released that for us in licensed capacity. We are preparing for it. We're not just waiting for them and then start planning. We're planning now. We actually have been planning for some time to roll those things out, but we have to be released to do so. I will tell you, I'm sure it's frustrating to you as it is to us that we have to wait for permission from agencies that are not operating our communities, because maybe sometimes we feel like we know better. But that's a part of being a licensed entity and being compliant. And as I said, our first and foremost priority is for the safety and health and protection of you, the people that we serve, as well as those who come into contact with you. So I would certainly invite Kelly or Bethany or Donna or Dawn to add to that. I just think that as we receive this information, we're going to just have to take some well thought out steps, be in communication with you, your family members, your essential caregivers, to let them know how we're doing it. We're going to continue to remain transparent. When we do this information, we'll be posting it on our website and getting information out. But it is going to take, it's not as easy as CDC sending out a press release and saying everything's roses. It takes more work and process to get it implemented. So that's a lot. Let me pause there for a second. Kelly, Bethany, Donna, anything you want to add to that?
I was just going to add, Mark, that we do have masks that have a clear opening over the mouth that we can make available if that's helpful to aid in communication. So that is one tool that we've looked for and added to help with that. So Donna, if you need some of those, let us know. We can get them over there to you all, so it can help with the lip reading part.
Nothing is going to substitute what you've asked for, and we know that. We do want to take those steps. We want to be responsible in those steps. Our organization fared, other than one initial case when it first came out, our organization went months, actually the majority of the year, without cases. And then when there was a quick response to open visitation that happened around Thanksgiving, there was a rapid spread and a rapid explosion of exposure in cases. We want to have learned lessons from that experience. The desire and the hope of opening up and getting back towards normal, but not going in that direction without considerable caution, so that we don't so that scenario is not presented to us again. Does that make sense?
Yes, it does.
Okay. And would ask, I think you're it's almost like you're sitting in on our meetings, because you really asked the questions that needed to be asked. And so, Donna, I think you've got an incredible partner there in being able to not only represent particular individual needs, but also the needs that really represent the residents at large. And so as good as I know my team is, that kind of additional questions and guidance and desire, not only that will help shape our policies and procedures and implementation, that's really good for us when we're talking to our elected officials and let them know what the expectation and the needs of our residents are as they go to advocate on behalf of how we're going to progress through, ideally, these decreasing numbers. So thank you very much for being thoughtful in those questions. We really appreciate that.
Well, thank you very much for providing us a safe environment to live in. That's very important to us. We don't want any more cases of positive exposure to the virus. The things that we're asking for are relatively minor when you look at it as a whole. So hopefully you'll be getting some guidance from Williamson County or whomever that controls what you have to do in the near future. But thank you very much for providing us a safe environment. Your people are doing a wonderful job. Thank you.
Well, thank you very much. I've shared before, it is always my privilege to be able to receive those accolades. And it is very much the team that is taking care of that. So we actually are going to have a town hall teammate town hall meeting, and we will share your comments with them. And we want all of our staff to know your appreciation.
Okay, thank you.
Do we have other questions?
Morning. Good morning, Mark. It's Pat. I have basically the same questions that Andy had. We would like to introduce you to a lot of our new residents. We're getting new residents every day, thank goodness. And it's fun to have new people here. And they all say, "Who is Mark?" Well, I would like to know if we're going to be able to have a town hall meeting like here in assisted. Our dining room is set up perfectly for a town hall meeting with you all being here in person. And I was wondering how long that would be before we might be, or do you have any idea yet by following the guidelines of all the entities that are involved?
Sure. Well, I would love that. You have a beautiful dining room, and I've always felt very welcomed by the residents when I've come into town hall meetings. And I've enjoyed town hall meetings. We've been doing that now for a few years, and it is it's a great time to come together. And I will say that building has never been shy to share thoughts or ideas and what's going on. And I think that's great. That's how a community lives together. The question that you asked is a tricky question. And so the shortest answer is to say is as soon as we're able to cross over into different buildings and to come in, we will. And that's again for protection of you and teammates. You know, it only takes one other person to expose somebody. And so that's what we want to be careful about. I'm not sure guessing is a great thing. I will tell you something, you know, all of our board meetings have gone to virtual meetings like this. And I will share with you, tentatively speaking, we have planned for an in-person meeting for whoever would like to for the fourth quarter of this year. Because we want to have on our calendar a plan to get together to meet. We want that as a goal, and we have that hope. My hope and prayer is that as we progress, we can do it sooner. I don't know. Again, you know, when I shared that number, that difficult number of the number of cases, and I don't know the specific number. It's actually 31,000 some odd cases that are new in this past week. If you take that number, those new cases in Texas, that's 30 some odd thousand. And you take the number of people who have been fully vaccinated in Williamson County, that's 36. Those numbers are very close. And so that's for as many people who have been fully vaccinated, we have almost that many new cases in Texas. Again, we're not seeing the horribly tragic numbers that we have seen in recent times. But if you were to take where our numbers are today, and you compared that back to a year ago when everyone was really concerned about this outbreak, our numbers are well above those numbers. I mean, significantly above those numbers. And so, I don't have an answer. But what I along with our plans, again, I want to reiterate, plans for the future, plans for coming back together, plans for opening up, plans for visitation, guidance, travel, all those things that are important to you and to us and our family members that are watching and our teammates. All of those things, we're not going to wait until someone says something to plan. We're planning for that and have been planning for it. We want to be ready that the moment we can, we're prepared to do so. It might take us a few extra days on top of a release to do so that we can implement the strategy, but we are planning. So I guess my best and long-winded answer is to say, I want to be there as soon as I possibly can. If I were a better guesser, maybe I'd be playing the lottery, but I don't. But I think it's important for us to have on the calendar to come together this year so that we shoot for that goal. How does that sound? Okay.
Sounds great. Thank you.
Of course. Any other questions or comments? I talk a lot, so I'm not sure if we've left anything off the table, but Donna, anything else of people coming to you with questions or anything else we can answer for you?
I don't believe so. I believe that all the residents were told to go to Andy or Pat if they had any concerns, so.
All right, well, we appreciate that. The fact that you have taken on that stewardship, that is wonderful. And we also want to make sure that we are a support to you as well. I don't think it can be said too many times. I talk to the board member, or to our board officers probably every couple of days. I'm in constant communication with the board of directors. We are so thankful for our residents, for our teammates who've laid it out on the line, for our family members, not only for those who have come in, who've gotten vaccinated, those who've followed the protocols, those who have had to wait to visit. This pandemic, the winter storm, has burdened everybody with the requirement of a significant amount of patience. And although it's a very small gesture, for that, I say thank you. This has been a new experience for the Wesleyan, for many people, and how you have all worked and lived together as a community has made it something that we have been able to live through. So thank you very much. If there are no more questions, this will end our town hall meeting. For those that have joined us, thank you for the questions. For those that are watching it live, if you have questions, let us know. For those that are watching it later, please send questions in to us. We want to remind you that this is a great opportunity to answer questions and to talk about things. It is never the only opportunity. Donna and her team, our team, we want to be able to answer these questions. We know there are going to be a lot of questions as these things that were presented by Annie and Pat that were brought up, you're going to have. Don't wait for gatherings like this. Please ask us questions. I want to thank you very much. I hope you're staying healthy and safe, and have a great week.